In New England, we have some very long, very dark winters, and that seems to affect children and adults in terms of their mental health dramatically. We do see in our emergency department a worsening of depression and anxiety as the seasons change. This is complicated by the fact that many adolescents and children are stressed by school and that the winter months tend to be more stressful than, of course, the summer months. But we do also see a number of changes that happen with children and adolescents in the winter time. During the winter, we see much worsening of depression. Children whose depression may have been able to be controlled with just family support during the summer months, getting much worse during the winter, and children starting to have those severe warning signs of being hopeless, of thinking about hurting themselves, of thinking about just not wanting to be alive. And so seasonal depression and anxiety can get much worse and even life-threatening during the winter. It's something for parents to watch out for. Children tend to sleep longer and have more difficulty getting up in the winter. They tend to eat more if their mood is being affected by the sun. They also tend to have a lower mood and higher anxiety and larger numbers of panic episodes. If you suspect or you've noticed a pattern over the years of your child doing worse in the winter because of, let's say, the light being lower or the weather being poor, it is something to bring up to your primary care doctor or with your mental health professional. Especially if parents are seeing that their children are having dangerous thoughts, maybe are writing about suicide or talking about suicide, or they're noticing on their Facebook page or their Twitter page that it's becoming more dark and more morbid. There is a 24-hour hotline available in Rhode Island, and that is staffed by mental health trained clinicians who can answer the phone any hour of the day, discuss the problem with you, and figure out a good resource to hook up the parents and families with. They can also advise you as to whether or not the emergency department might be a good way to go in that moment.